Actually, the purpose of this call is just for research and training purposes, and may also be
Okay.
recorded. Uh, we
Okay.
will also record it for training and research purpose, nothing else. The primary purpose of this interaction is like just trying to figure out what kind of questions, those 5 questions, can be drafted. Though you've already given me a brief overview, an idea of what could be the decent and appropriate topic to discuss, but at the same time you just want to have an interaction, and at the same time get compatible and comfortable so that we can pitch in something very important and relevant, the discussion, the interview we're going to be covering in the times to come. So
What you have, planned for the interview? Like any idea you have?
I was little more into like what could be a better possibilities to conduct
Okay.
community and like mass level research which is going to be empirical in public health, and how to raise concerns such as like awareness level on public health. These could be two important
Okay.
questions, and another question I was wondering, is it appropriate or
Okay.
not, COVID-19 vaccine. Other people report that the load of heart attack, things like that, that's a rumor, we know scientifically, but still like it's one of the concern and kind of confusing thing for public health. So those were the areas, but I would like to know your mindset so that we can draft appropriate questions, authentic point, I mean, to the point questions.
Okay. Okay. So I think like we can go for some outreach activities. Like outreach activities in this, we can cover everything. Like what are the activities which we can go for some question might be related to some outreach activities. Like because the outreach activities included everything. What are the what are the programs run by the government in the public health sector? What are the challenges they are facing actually, and what is the utilization rate of all these programs. So we can discuss that part also. That will be very beneficial for the public health experts. And I think what can be some outreach activities. Okay.
Outreach activities.
Outreach activities, yes. Because I'm doing a lot of activities in the public health sector, because my specialty is public health only. So I'm doing a lot of activities, and since I am a public health expert, so I have faced a lot of challenges also, because some of the time people are acceptable, sometimes people they don't want to, they are not acceptable, sometimes they are acceptable also. So a lot of things are there. So I think we can go for one question that might be related to some outreach activities.
One, we can draft like outreach activities, programs, and challenges faced by the government. Or another question, which can be a subtype question, like as like you should have conducted your outreach activities, what challenges you faced, natural challenges and some sort of unpredictable challenges, which might be very weird and strange kind of challenges. It may be in terms of conducting research, awareness programs, reaching people out, raising their level of awareness, things like that. So we can draft another question which is a subtype
Yes,
question.
yes.
So those, and yeah, these two questions can also be covered. Yeah, certainly.
These questions can be covered. We can ask for like attitude of public health experts while conducting researches in the areas. Because I have find out some some fraud, or we can say that fake researches also. People they didn't collected the data, and they just published the data like anything in the peer reviewed journals. So I'm a a reviewer in many journals.
Okay.
Around 18-20 journals. So when I came across those type of researches, so I was little bit surprised, like how can they
attitudes of public health experts in conducting research, while like in terms
researches,
of fake
we can
research data, non-reliable data, non-authentic data.
Yes, yes.
So
Yes,
that could be third.
And it was surprisingly like statisticians also doing analysis of that data. How it can be possible?
Agree.
So this can be third question. Yeah.
Public health research or approaches in developed countries, and public health research and approaches kind of instrumentality in developing countries. That could be one. I don't know exactly, but
digitalization in public health. This is a very good question. What? Because now everything is digitalized.
Digitalization.
Yeah, digitalization in public health.
Okay.
Public health sector, because now everything is digitalized. Even the ANMs are getting everything on their mobile phone. So we can ask this question also. This is very important.
Yeah, it's an important question.
Digitalization in public health sector. Yes.
Public health sector. Yeah, that's really a great question. I really agree with that.
This is very good question. This
Yeah,
is very good
certainly.
question.
It's a wonderful question. I agree with that.
Yeah. Yeah.